I'm really honored to be here, especially with it being a North Texas initiative. So appreciate to be in your company and very, very glad for the networking opportunities we have here today. So I want to talk to y'all quickly about some steps for success in medication take back. At Texas Tech, we started a medication take back event program in 2009. I had started as the managing director of our Poison Control Center in 2003, and we have calls every single day with kids getting into medications, young children, also teens overdosing on medications, and we knew it was a big issue. It was something we wanted to help address, and we knew by getting medications out of homes that were left over, we could help with that. So we started this program in 2009, which was before the DEA program. As of April of this year, we've had 50 events across Amarillo, Abilene, Lubbock. We've had several in small communities across the Panhandle as well. From those events, we've had over 13,000 participants come and drop off medications. So you may wonder why there's an RV there. I wish it was mine. That's about the weight of the medications we have collected over the years, over 36,000 pounds of controlled and non-controlled medications. We also collect sharps, which I need to point out is not something the DEA days supports. So if any of you are going to have programs that collect sharps, they have to be done separately. But there is a huge need for collection of sharps. In the Panhandle, we're not quite as green yet. And people just don't know what to do with their sharps. So they will throw them in the trash. We've collected almost 2,000 pounds of sharps to date. So this chart kind of shows per year how the program has grown. The green line represents how many participants have come through. Our programs are run as, or our events are run as a drive-through. We like to keep the public in their cars. That way we know if they're all kind of contained and they're not mingling through our processing area. The blue line represents the pounds of medications that we have collected. So last year we collected a little over 6,600 pounds of medications. So what are our secrets to success? We have a really supportive host institution. Being at the School of Pharmacy, our administrator saw the importance in this, and it's not only that, it's a huge teaching opportunity for our students. They volunteer at our events, and once you see the volume of medications that come back, it's something that will never leave them through their entire careers. We also have sort of an ongoing funding source. I'm the director of our Poison Control Center, and obviously medication take-back is poison prevention as well. So we have been able to kind of carve out funds from our Poison Center budget to help support the program. In 2010, HSC actually offered Poison Center incentive grants. There were 16 of them across the U.S., and we received one. It was $100,000 per year for 3 years. It lasted about 6 months before they pulled them back. So we did get the first year of grant funding, and then it was gone. So basically, we rely on the Poison Center funding, and our Poison Center, every legislative session is at risk, so it's not something that I see as being a strong funding source. We have also gotten a grant from Xcel Energy in the past, and we're hoping to work with them in the future as well. So they're our electric company up in the Panhandle. One of the things that I think is a secret to success, the DEA days are fabulous. They're a great opportunity to work with law enforcement and take advantage of the national recognition of the days. But for us, we have a set of people who go to each event to help work the event, and we obviously can't be in more than one city at one time. So we do have some events that are not on DEA days, and in that case, it's really important to have a relationship with law enforcement to make sure that they man the event, they oversee it, and they maintain control and custody of the controlled substances throughout the entire event. Effective advertising is also one of the keys to success, and I'm going to talk really briefly about how to do that on a low budget, and then a consistent ongoing program. This program has just grown and grown, and people ask, how do y'all get so much drugs? How have y'all succeeded at this? The public knows we do this twice a year now, and so they will start calling and asking, when is your next event? They'll ask at the pharmacies, when is the next medication clean out? So law enforcement, We had a difficult time getting buy-in with our local law enforcement in 2009. We actually had to go to the city council and really push. But once the program started and we had law enforcement participation, they were fully on board. They've been very supportive ever since, and it's incredible. But you definitely have to have that relationship. The way I like to present it to law enforcement is, this is what we need from you. And these are the things that we are going to do to minimize the workload on your people. They're usually kind of scared about the volume because they envision 55-gallon drums of medications coming in. For our program, since we have pharmacy student volunteers, we actually separate out the controls and non-controls. And then by doing that, law enforcement only has to take the controlled substances and store it and destroy it. So it reduces the burden on them for participation as well. We have only recently had to actually pay for officers, and that was in Lubbock this past event this spring. And I want to say they were around $35 per hour. But it is something you want to prepare for. I think it's relatively inexpensive, all things considered. And we need to, when you're doing a program, you need to know if they will, whether you're doing it on a DEA day or not, are they going to store the medications for the DEA? In Amarillo, obviously, we're very far away from Dallas, and sometimes the DEA cannot get to an event by the end of that Saturday. So they will need law enforcement to store that in a secure facility until DEA can get it, or law enforcement actually takes it to the DEA. I have to mention really briefly, since Lisa's here, when I talked to Lisa about this in 2009 when we were first starting, she thought I was crazy. Now she knows I'm crazy, 7 years later. Be safe. We try and be very cognizant of the fact that our events could be targeted for theft. It makes sense. You want drugs, they're collecting them. We actually had a lady come to one and say, "Is this where I get medications?" She thought it went the other way around. But make sure when you're choosing a site that you consider safety of your volunteers. We always use our campus sites. We have large drive-through areas available and then indoor processing that we can keep restricted only to our volunteers. For ours, we have one officer inside that manages the sorting and the controlled substances, and we like to have one outside, preferably with a patrol car, which is just visibility that we have law enforcement. Choose your staff wisely. Obviously, diversion can occur, and we don't want to be ignorant of that. If you don't know these people, if they haven't had a background check through your place of work or your volunteer organization, it's something to consider. Be prepared. Will the event accept all medications? If you're doing a DEA day, they don't accept inhalers. So in that case, it's important to pull these things out. And you cannot tell the public we won't take inhalers and expect them not to bring them. They will hide them. And they will do the same thing with sharps. So unless you're going through eyeballing every single thing that comes in, they're going to be in there. But you can at least put up signage and advertise we will not take inhalers. Also, chemotherapy can come in. Usually it's marked, so it's just something that we train our volunteers on how to manage it safely, how to handle it safely, which is usually don't handle it. They all wear gloves. We put it directly into a disposal bin if we get it. And then sharps, they will bring sharps. We learned very early on that even if we said we do not take sharps, they just put it in there. And then you're even more at risk for an injury because they've hidden it and they didn't tell you it's there. So now we ask them, we stated, we do accept sharps. Did you bring some in your collection today? And that way they know we will take them and they're actually willing to tell us, yes, there are some in there, be careful. Prepare your employees how to prevent needle sticks. We have had 2 students who have been stuck by needles at the events. I wish I had the time to go into that, but I don't. And they were tested and put through the appropriate protocol through our university. But it is a risk, and it's something that can be prevented. They were both silly mistakes that should not have happened. So really quickly, we have pretty low budget. I would say probably around $8,000 per year for 6 events is what we use. We do have the Voices Coalition in Lubbock that pays for our advertising there, which is pretty significant. But what we do for low budget advertising is we print off flyers and pharmacy tier pads. For Amarillo, we pay about $350 for one event, and that covers 2 flyers for each pharmacy and about 6 tear pads. The tear pads just have the event information. The pharmacist tears one off, puts it with the prescription bag as they're dispensing those. We distribute those about 2 weeks before the event, and it's been very effective. Okay, that's an example of a front page sticky ad. This is our most effective advertising method in our Amarillo area. So it's just a sticker that goes on the front page of the newspaper. As you guys know, probably a big portion of our participants are elderly, and they still read the newspaper. So this is very helpful. They'll actually pull it off and stick it on their bag when they come in. That's just an example of our flyer. It's just a PowerPoint. This is an example of our tear pad. And then our drive-through, we have the volunteers wear safety vests. You can see somebody chose not to, but that's also a risk. They can get hit by a car out there, and it has almost happened. So one thing we like to do that I encourage, but DEA discourages, is we do surveys. They are completely anonymous. We don't ask for any identifiers other than a zip code, and we're trying to see how well our advertising worked. So I know I'm out of time, so just some things I've put in here so y'all can look at. If you're getting grant funding, the surveys are really nice to have because they give you an outcome measure. This one in particular, we asked them, what would you have done with your meds if you couldn't bring them to us today? And majority of them will say they would have kept them, which is a risk. So it gives you a way to provide whoever's providing you funding with some outcome measures to hopefully maintain funding. And I'm going to have to let y'all go through the rest of these on your own. We do have both the drop box and our take back events. They complement each other. When Abilene PD decided to start a receptacle, they called us and said, is this going to mess up your program, your take back event programs? And we said, no, we really wanted a box there because they complement one another. So thank y'all for listening.